Good afternoon, everyone. My name is Chris Kirby. I'm president of the bar for 2025. Thank you for attending this final session of our MCLE conference. You should have received an email with the evaluations for every session, including this one. There will also be a copy placed in the chat that you can click on at the conclusion. I'd like to introduce our speakers today. We have Dr. McCole Davis, who is a clinical psychologist with over 45 years as a mental health professional. He is a subject matter expert in aging issues, particularly testamentary capacity, dementia, and cognitive impairment. He maintains a therapy practice and is a consultant and co-mediator with his wife, Carolyn Rosenblatt, at agingparents.com. He has extensive experience with family conflicts and volunteers at Marin County Court as a settlement panelist in high conflict matters. He has treated many lawyers over the years who have suffered from unmanaged stress, and he teaches tactics for stress management. Carolyn Rosenblatt is a retired nurse, public health nurse, and attorney at agingparents.com, consulting with families with age-related issues. She has 27 years of PI litigation and trial experience. She has subject matter expertise in age-related healthcare, legal, and financial issues with families, and she mediates family disputes. She is an ABA published author. She also volunteers at the Marin County Courts as a settlement panelist. She is passionate about wellness and has developed successful strategies for managing stress within the legal practice and beyond. And I'm now going to turn it over to Carolyn and Nicole. Thank you.
Are we rolling, Bob?
Hello, everyone. Can you hear us? Are we muted?
They can hear you.
We can hear
Okay.
you.
Excellent.
Good, thank you. All right, so what are we doing here at the end of our conference? And you've been through getting your hours in, and our purpose today is really to help you understand about what you can do about stress, which does not include getting rid of it. You can't eliminate stress. It's part of our lives. Everybody's got it. We have it in various ways and different degrees, and we're going to talk about that. And we have an automated response to stress that we cannot control. But what we can control is what happens right after that automated response. And we're going to give you some quick practical tools to help you get through what you think you might be helpless against, which is the effect of stress on your whole person. So, my background, as was mentioned by Chris, and thank you, Chris, for the introduction, is in nursing. I started out, of course, in hospitals, nursing homes. Then I was a public health nurse, which meant that I visited thousands of people at home. My total number of patients that I've had my hands on or had personal responsibility for was over 10,000. And I am grateful that every one of those patients was my teacher. Not all of us have that many teachers, but I learned a lot about the relationship between stress. And even with all that knowledge that I thought I had, when I started practicing law, I had 100% PI practice here in Marin. That's contingent fee work all the way. No billable hours, no getting paid for showing up or trying or doing research, only getting paid if you are successful in bringing that case to a conclusion, which every contingent fee lawyer knows. All right, so that is constant combat for decades, and it takes its toll. I did not want to become a casualty of that stress. I'd seen people do that. I didn't exactly know everything to do to help myself, but not everybody has a in-house shrink like I did. And Nicole here, we've been married for 43 years, taught me a lot. One of the things was take vacations, and he'd plan those, and I'd go, what, I can't do that, I can't. But he would make me do that. He'd make the reservations, and I learned from him the world will survive even if you take breaks. I can remember calling the office at lunch from the ski slopes or the beach or wherever and giving my paralegal or associate instructions about what to do with the thing that just came in. But anyway, it somehow worked out. I delegated those things and I survived in one piece. No chronic illnesses. It was a job in itself to manage the unrelenting stress over 27 years of litigation, which every litigator knows. And I used a lot of the tools that I brought with me to the practice of law, but also that I learned from a mental health professional. And those helped me survive. Okay. And I've learned more since then, too.
My turn. My journey was a little bit different from Carolyn's in that my personal experience in terms of where I have come from and where I am right now, I decided after getting through a doctoral program and the challenge and the stress that's involved in doing that, um, I decided that I actually wanted to see what I could take on that would be a bigger challenge in terms of stress. And so I decided to learn what it would take to learn to fly an airplane. And so I hired an instructor and would practice flying out of Noss Field in Nevada. And one of the experiences that I had in learning how to fly an airplane successfully was to learn how to deal with emergency situations while flying. And one of the things that occurs sometimes when flying in an airplane is that if, as you're climbing in an airplane, if there isn't enough power to pull you up, the plane starts to shimmer and quiver and shake, and there's a horn that sounds in the cockpit that alerts you that you're about to do what's called a stall, which means that the plane will immediately start heading downward towards the ground. And the emergency procedure that you're taught is that the stress response that immediately kicks in is I'm going to die and the earth is coming up quickly and I need to immediately pull up the nose to save myself. And that's the exact opposite thing to do, which is what your stress response is telling you to do to survive. In that if you do that, that immediately will make the plane lose even greater power and will end up in the in an immediate fall even greater at that point. So the training is exactly the opposite of overcoming your stress response in teaching you the right emergency procedure.
And stress is part of everybody's life. I do remember when it reached a peak in my life. We had 2 young kids at home. I've got too many cases set for trial. My associate was screwing up. And within that same time period, my paralegal was caught stealing from my trust account. Okay, this is a major disaster of stress for me. And I didn't know how I was going to get through it. I just sat there and cried. And I thought, I can't do this anymore. I told Nicole, I can't do this anymore. And he helped me calm down and look at different things I could do. But I think it's important for us to all identify things in our own lives that we perceive as stressful. They're everywhere. And it's not just our work, it's our relationships, it's the things that happen when we're driving around. It can be anything. And our brains don't know the difference between a physical stressor, like getting attacked in an alley, or a perceived threat, which might be what your opponent's going to do or what's going to happen if you don't meet that deadline. Those are imagined stressors. Our brains don't know the difference.
Not in real time.
No, we react immediately the way Nicole was talking about. When your plane is going down, you go, I have to. That's the automated stress response. But the good news here, my good colleagues, is that we can do other things after the automated response happens to push back against it. Okay? We have the ability to do that. We have to learn specifics so we can train ourselves. We don't have to become victims of stress.
The important point is that stress is a perception, which is critical. It's something that we're sensing and we're telling ourselves is true, which makes us believe that we need to immediately respond. So we're going to talk a little bit about the science that really is involved in the body's stress response.
Right. So we perceive the stress. That does send a signal to your brain. Your brain then sends a signal to your adrenal glands, which are where your stress hormones are generated. They're not generated in your brain. Those adrenal glands are ready to go all the time. And what your brain perceives triggers that response. Then you get loaded with all these stress responses in the form of hormones. They are cortisol and adrenaline, also called epinephrine, and they just make you want to do something. You're ready to go. Your muscles tense up, and your body gets into this immediate response mode. And you have to do something. That's what your brain and body are telling you. You're already set up because your muscles are tensed and your pupils are dilated and your digestion ceases and your mouth gets dry and all these things are happening. But that's the first thing. You have to think about what's going to happen after that. And this is where you have agency. Okay. There are things you should not do. Now, if somebody comes at you, the immediate response sometimes after that automated thing is you want to yell back or you feel like punching somebody, okay? You know that you're going to have the response. Being conscious of what's going on physically is an important way to start your stress management strategy. You can't address something if you're not aware of it. So the first step, recognize what your body's doing. Okay, my heart's pounding and I have to have a strategy here. What is it? What is it? What is it? You can't just blurt out whatever comes to mind first because that could be dangerous. You're going to regret that probably. So you recognize that your body is doing something, know that you have measures to employ. And we're going to get into those measures in detail.
But without having that sense of objectivity, you don't have the freedom of choice.
Right.
And that's what's very critical here.
And that's what overwhelms us. We feel like we can't do anything about it. Our heart's pounding and we're just kind of standing there helpless or feeling that way, secretly, perhaps, if you're doing a litigation. But, yeah. Okay. So you want to think about stress in divisions. We've divided it based on some scientific research. A lot of this is based on science. And I am a science geek, I admit. Physiology has fascinated me since I was 5 years old, and my grandmother, who was a nurse, gave me a little book about the human body, and I could read by the age of 5, and I looked at it, and I could not stop looking at it. I read it over and over again. So that fascination is still with me. But the science tells us now we can look at our stress in terms of short term, medium term, and long term. And the strategies we're going to lay out for you can be employed in those various arenas.
So let's look at the first one, the first type of stress, which is labeled short-term stress.
Right. Okay, it happens right now. Have you ever had somebody yelling at you?
No.
Does this person on the other side of your case or somebody you don't like in your firm or whatever, have you ever been on the receiving end of that phone call?
Lawyers act like that?
Yeah, they sure do. And that is a short-term stress because it's right now and you can't go meditate and you can't go lie down and rest and you can't go do anything that we do, which we'll describe for managing those things. But you do have choices. You do have things to address short-term stress. We will tell you what those are. Then we have our medium-term stress. This is about deadlines and projects and discovery cutoff and other things that have an end that you can see. In the meantime, the pressure is on. You feel it's weighing on you. You're uncomfortable. You have repetitive irritants going on at this time. Somebody's interrupting you when you're trying to get something done. You have longer term tools that we can use to help with that kind of stress too. And it is something you have to get past. There are a lot of small tactics you can use, which we're going to discuss coming up.
All right. And then there's long-term stress.
Right. Some people also call this chronic stress. Of all the kinds of stress that go on, the chronic stress is the hardest on our physiology. It's the hardest kind of stress, and it leads to devastating physical outcomes. I want to share a story with you. Of all those patients I had, thousands of patients, there are some of them that just stood out as shocking to me. One of those was a 15-year-old boy on the pediatric unit in the hospital with a serious condition called ulcerative colitis. Okay, that means his entire bowel was inflamed, bleeding, sores, and they were just talking about taking out part of his intestine at 15. And I had just had my lessons about stress from my nursing professors about how that affects illness. And I thought, oh my gosh, this is it right in front of me. And I remember talking to this child in a quiet voice, asking him about the stress in his life. And I remember his eyes widened and his jaw dropped. He said, I never thought that was part of this. Well, we talked about it a little bit. I spoke with his parents. I hope something changed because he was not headed for a happy adulthood or a healthy life. So, chronic stress that he was already experiencing in his young life is corrosive. Corrosive. And I think that it's very important for all of us to recognize that we're not just talking about stress and health, we're talking about how dangerous it is if you don't address it.
But it's also indicative of our education,
Yeah.
of how we teach young kids about how to best manage life. And it's often not from a place of proactively learning what they need to do to manage the stress as a child and the expectations that they have as a child. It's often focused on achievement
Sure.
and
Pressure.
being productive
Do well in
and
school.
accomplishment.
Right.
It's all in that vein, and it's not about, how do you deal with the stress of the conflicts that happen on a day-to-day basis of dealing with kids that are unkind, or now children dealing with how do you deal with the challenges in social media that happen. All right, so let's talk a little bit about the first stress response management tool that we are going to share with you, which is called the
physiologic sigh.
It's what they call it. All right,
Okay.
let's talk a little bit about
And
that.
this is related to the second tool, which is 4-part breathing. That's different. This one is immediate. You can use this in short-term stress. You can use this anytime. You don't have to do anything to count lengthy processes at all. It is a deep breath and then another inhale quickly and then a slow exhale. What does that do? Okay, that slows your heart rate. Remember, your automated stress response is adrenaline, speed up your heart rate, tense your muscles, widen your pupils, dry mouth. All these different things are going on in your body, but you're going to reverse that to some extent by this: the inhale, the sniff on top of that, and then and someone would hear you doing it if they're listening to you on the phone, or you can mute yourself. But the reality is, this is an immediate intervention into the physiologic response that you are pushing back against. So it's the physiologic sigh, and it works.
And there's something also scientifically grounded in the fact that you take a deep breath, but then you take a little bit more oxygen.
Right.
In terms of expanding your capacity,
Right.
that has an effect on the physiology and affects your ability in terms of your thinking and what is causing stress in the moment.
Exactly. And the long exhale is what slows your heart rate. Okay. Just remember, you have agency over that. Your heart may be pounding, but you can make it slow down. And that's one of the ways to do it. And that flows nicely into the next tool.
Let's talk about the second one.
All right. And some people call this box breathing. Some people call it 4-part breathing. This is one of my favorites. I learned this a while ago, but it works well because it does the same thing as the physiologic sigh, but you can keep repeating it and nobody has to know. I have done this many times when I have to do a presentation that's making me nervous. I'm feeling some anxiety. Did I get it all? Am I going to remember? Will I be able to do advance the slides and all these things? So it is 4 parts, and Nicole is going to count for me. And it's 1, 2, 3, 4 of inhale, hold for 4, exhale for 4, and hold for 4. And this does the same kind of thing, slows the heart rate and directly goes against the physiologic response that has automatically started in your body. So here's how it works. Nicole, you count for me.
Here we go. 1, 2, 3, 4, 4, hold, 4, 3, 2, 1, exhale, 1, 2, 3, 4, hold, 4, 3, 2, 1, stop.
Really simple. And this is something everyone should know as a tool because we're all going to encounter things that are immediately triggering for us.
But how many times do you need to do it to get the benefit?
If you do it once, you're going to get some benefit. If you keep doing it, if I've got to go on stage or I've got to, do something that's stressful for me, I will do it as many times as I can before I have to go. I do this before athletic things. I do it before speaking things. I do it when I know I'm going to have to encounter a difficult person. If we have a really snarly family mediation we have to do, I'll do it before we start that because I know it's going to be hard. But it reduces my anxiety and helps me stay calm. And it mitigates, as I say, against that pounding heart that you feel immediately when you're exposed to a short-term stress.
I think there's something magical about doing it at least like 7 times. That's what I've experimented.
Could be. I just keep doing it until I have to talk.
All right, management. Here's the stress management tool number 3. Let's talk about that.
All right. So activating your body, and this is going to sound a little strange, but if you have the opportunity to do regular exercise, and this is for medium-term stress now, you're not going to do this when nobody's screaming at you on the phone or in your face, but you need to incorporate something into your regular routine that is definitely worth doing. And then you're going to control your stress response by speeding up your heart rate on purpose with exercise, and then doing some slow breathing. But the one thing about exercise is that it dissipates those stress-related chemicals we were talking about, those hormones of cortisol and adrenaline or norepinephrine. Okay, so even a brief walk, if you are under a deadline and you are feeling irritated because somebody interrupted you and you've got the pressure that discovery is closing or you got to disclose experts or whatever your deadline is, you've got to get this presentation for the client with this huge deal that's pending, you've got to get moving because your body wants you to get moving. Remember, your stress response is already there in the background. It's just not as acute as short-term stress of somebody coming at you verbally right now. But it is present. And if you have the opportunity and create the opportunity for yourself to just walk up and down some stairs, get out and go around the block, anything. When I'm sitting all day, like I've been in this program with us today, and I'm not getting any exercise, it's not that I'm feeling anxious, but I did want to get my heart rate up before I was doing this presentation. So I went up and down the stairs in my house about 7 or 8 times and then slowed that down. That dissipates any stress hormones that you have. It's really helpful. You don't have to join a gym. You don't have to ride a mountain. You don't have to do anything extremely vigorous. You just have to move. So what do you need for this in forms of equipment? A pair of walking shoes that are comfortable. Okay, if you have no idea how to do exercise on your own, please help yourself by finding one of the videos. There are countless videos, and there was an explosion of them during COVID. Some of them are 10 minutes. They're on YouTube. Stanford Lifestyle Medicine has some on joint health and mobility. They can be a full hour, they can be a half hour, any amount you want, okay? So there's so many to choose from. I would think you should get one if you're not a gym goer or regular runner or a sports player or an exerciser, as you would define yourself. Find something you can do on your own at home or wherever you want, because you can get it on your phone, obviously. But make sure you have that. If you don't have that, you're just going to say, oh, yeah, I'm supposed to exercise, but that's not what I do.
Well, then you kick it down the road.
And you lose the opportunity to manage your medium-term stress.
So what could possibly happen if you don't manage long-term stress?
Well, our bodies are not set up. We are set up to dissipate that cortisol and adrenaline because in our evolution, our prehistoric ancestors were always on the move. If they were being attacked by another tribe and people were using primitive weapons to hurt each other, they were dissipating stress by the movement. Or if they were running away from danger, of, whatever danger existed in their particular milieu, they were dissipating their stress hormones just by that. We don't live that way now. We spend a lot of time sitting in a chair, okay? But chronically high cortisol is really dangerous. And I looked up some of the effects because I, in sense, know them because I've seen the effects, but I wanted to see if there was a list. Oh, yeah, long list. All right. What does undissipated stress hormone level do in your body? It increases your blood sugar. Well, that puts you more at risk for type 2 diabetes, one of the huge chronic illnesses in our society. It can also promote chronic low-grade inflammation. That inflammation can cause increased anxiety, irritability, depression. I think we always hear the phrase, oh, my blood pressure went up just talking to that guy. All right, it does. The stress hormones in your system do increase your blood pressure. It causes insomnia. Anybody have trouble sleeping? Increases heart disease risk. Okay, heart disease is the biggest killer in this country, has been for as long as I can remember. And we are adding to that risk, not just by what we eat or do or don't do that isn't healthy, but by stress. We don't need to add to the risk. It's just not good for us to maintain heightened stress response over long periods. If you're having trouble in your personal relationships, there's stress at work, maybe you've got a kid that's driving you nuts, maybe some horrible thing happened, that you have reacted to in your world. All of that put together can wear you down in ways you're not even seeing because you don't feel it. They call high blood pressure the silent killer. Okay, but we are not helpless. We can do these things we're talking about. Okay. And some of them take practice. All of them can become little habits. Okay. So there's a good one that Nicole taught me about. I did not know about this from my nursing career, but it's the next stress management tool.
Before we go to that, I just wanted to mention that in my clinical work and seeing patients for all the years that I've had, um, I clearly see a direct link in individuals that don't manage their stress level well, and having an increased level of um, what do we call that?
Hypervigilance.
Hypervigilance, yes, a very good term. And I see it a lot where when you don't manage your stress, there's a level of hypervigilance where you're always right on the verge of reacting and responding, and 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 it affects a great level of dysregulation of your emotion. So I just something that clearly I see over and over again that's related to what you said, the various diagnostic areas of anxiety and irritability and depression, and it's so much related to stress, and especially when I get referrals from cardiologists because people have had heart attacks and want to learn how to manage their stress and are just very disconnected from how stress affects their body.
It's your
But
mental health too.
yeah, but let's talk about this one technique called progressive muscle relaxation. And uh, you did get a handout. So just to call your attention to that, one of the handouts that you do have goes through exactly the details of the script that you can follow. We'll talk about that for just a second, but do an overview. Um, I love this picture of this little kid because it just, for me, it just very much depicts what I think happens for little kids when you see that they're getting upset about something. The technique was called progressive relaxation. It was developed by a physician in the 1920s, 1929, by Dr. Edmund Jacobson, who developed this technique. And what he found is that an effective way to deal with reducing one's stress level had to do with people reconnecting with their body. And so the progressive relaxation involves the constriction of different muscle groups, holding the tension for a period of time, and then slowly releasing the tension with an awareness that you're consciously choosing to let go of that tension And it just highlights the conscious thought about the contrast between what it feels like in your body between the tension and the relaxation. So let's kind of do it very quickly right now. We're not going to do it extensively, but let's start with what this little kid is doing, and we'll do it with our fists. And what I'm going to ask you to do is hold the tension in your fists as tight as you can for a period of time. Sometimes your hands will shake, but just hold the tension, feel what that feels like, and then slowly let the tension out by opening up your fists. Okay. So the direct contrast of directing your attention, your thinking, your conscious mind to that contrast between the tension and the relaxation. The process involves starting with the muscles in your toes, working your body and the muscles from your toes to your ankles to your legs to your upper thighs to your stomach to your chest, obviously to both arms, muscles in your neck, your face, and again going through that contrast between the tension and the relaxation. It's very easy to do quickly. And what you notice is that often you're alerted to the fact that there is a level of tension that you're holding in different parts of your body that you may have not realized that you were feeling.
This is really helpful if you can't sleep because you're worrying about something. You're already in a heightened state of stress because of that, and you just can't let go of it. This is helpful for me, at least sometimes when I'm trying to fall asleep and I'm having trouble with that. Going through the whole process takes a bit of time because you're doing, clench, release, clench, release, clench, release all the way to the top. But it really does help get rid of that stress hormone response.
All right, let's go to number 5.
Okay, so
Novelty. Let's talk about it.
you had an experience. I think it's worth sharing about a lawyer. This is a real case.
Oh, a lot of cases. Just quickly, I can tell you I was treating a trial attorney who was so stressed that he passed out on the floor in court during the trial. Just obviously the most embarrassing thing I would think in the profession to do that in the middle of court, but he was so stressed and was so disconnected with what he was trying to deal with and obviously not dealing with it well, that the pressure of dealing with the increasing billable hours that he had to produce, it had impacts on his interpersonal relationships at home. He had never done any kind of therapy or have never seen a shrink before or alerted his medical doctor about what was going on in his life, not doing any kind of physical exercise, limited sleep and nutrition. All these forces were affecting his health. And what it came down to is that it wasn't just teaching him how to best manage his stress, it was also encouraging him to look at his current employment and that perhaps the environment that he was in was a bit toxic to the level that maybe it was time to reconsider changing jobs, which he actually eventually did.
I think a lot of lawyers feel mounting stress over time. They feel mounting stress as things ratchet up in whatever you're doing. And there are periods where it's higher than it is at other times. We have these ebbs and flows, but I think it's really important to recognize that we have an opportunity to do something.
And the importance of what talk is about is the ability to externalize what most people just internalize and suck it up and just take it on and don't have a way of being able to use language to be able to express what's going on.
Yeah, and there's a difference between men and women. Women tend to talk more about emotions. It's not to say that men don't, but it tends to be gender divided in some ways, don't you think, from your
Clearly,
experience?
clearly.
So I think for the men among us who are not used to sharing their feelings, and the prior presentation from Cameron about that was touched on that, we have to be willing to admit that we're hurting. We have to be vulnerable, and that's hard for warriors. We are warriors, we're strong, we can fight anything, and we don't know how to be vulnerable. And that takes some doing, some practice. There are so many opportunities to discuss.
Well, one of the things that we also discovered through going through COVID was the importance of community. And
Absolutely.
that's one of the sixth stress response management tool is the importance, and it was touched on by Cameron in the prior presentation,
Hmm.
about having a sense of community, building community, and why is that important?
And there are a lot of things that we can do to create community. It doesn't have to be with lawyers, although the bar is giving us some nice chances starting today, even if you don't drink alcohol. You can go and just have some camaraderie. And I think it's really important that we look at that as a tool for stress management. We don't think of it that way. Just say, oh, I don't know, maybe I'll network before the next bar thing. But it is important to be there because that sense of community relieves the feeling of aloneness, and there's nothing worse for us than being in a high stress situation over a long period of time than feeling alone. All right, so there are a lot of different tactics. I think that the bar is doing a good job helping us find social connections within our own. We've had picnics, we have parties, we have networking before we do an event in person. And I think it's important to show up, even if you're not a talker. If you're an introvert, and a lot of lawyers say they're introverts, okay, the socializing and participating can be more challenging if you're a little bit shy and you don't feel like you like to socialize very much. But even if you are there and consider yourself an introvert, do what you do well. Be a good listener. Ask a question or two. That's connection. If that other person wants to share with you, blah, 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 fine. Then you're a good listener. That actually is establishing community because you formed a bond with that person for the moment or for a little bit of time so that you have a sense of togetherness. You have a place for yourself where you have chosen to be. And that is really important. We all have to feel a sense of belonging if we want to be healthy. Social isolation is horrible for us. And people have awful health outcomes, especially in the long run with aging, if they are isolated. But it applies to us too. Even if we're still practicing law and doing all kinds of things, we need to feel connected, and participating socially is one way to do
So let's talk about another coping strategy. Here's my dog meditating.
that. I think my dog meditates by putting her muzzle on my foot and falling asleep. I can learn from her.
Took a
Look,
lot to get her to pause to pose like that.
yeah, right. So, all right. So, meditation is often suggested. A lot of people don't know how to do it. You know, it's clearing your mind, it's this, it's that. Look, the easiest way to do this is with an app. There are guided meditations where somebody talks you through whatever the relaxation tactic is at that time. If you've never done meditation before, think about that. I like the one Calm. Jay Shetty does 7 minutes, and I use that to help me fall asleep. Headspace is really popular. There are a lot of them. There are different things within those apps, but you don't have to sit cross legged in a chair. You don't have to even be sitting up. There's a beautiful meditation program with music for walking meditation, which you can do outside. Gorgeous. I mean, if you do a little bit of research on that, you will find something maybe you're willing to do. But I encourage everybody to pick something as a coping strategy that has to do with chilling out and that does not necessarily involve um, alcohol. Personal favorites, the Honest Guys, I like them for falling asleep. You can do that. It's on YouTube. You can just listen. It can be very useful.
Let me just say something about this quickly because this comes up a lot in the work that I do with the patients that I see. Meditation, from my perspective, is really about developing the discipline of the mind, the ability to be able to anchor your thoughts in a way so that your thoughts are not controlling you. And so, what meditation often offers is an opportunity to have you focus on your breathing as a way to anchor your thinking. And that's a critical part of what the benefits are of meditation, is the anchoring of our thinking or our thoughts by focusing on specifically our breathing. And our thoughts will do what they do, but it's a way of being able to direct our thoughts to something that we're consciously choosing to direct it to instead of feeling that we are at the effect of our thinking. And that's a really effective way to reduce stress.
Yeah.
So let's talk about, can stress be good?
Well, every species has stress. You know, a plant can't bloom unless it has stress within itself. A baby can't be born unless the mother's womb signals that it's stressed and the baby needs to get out. In our bodies, stress of an invasive virus or bacteria stimulates the immune response. That's a good part of stress. Okay. And we need to have a stress response physiologically if we get injured, because that stimulates the stress response and helps us heal. But it's more at a physical and less perceptible level than a perceived threat would be. Still stress. So we need the stress response to stimulate high performance. Before I jump in the water at an event I'm doing, I am stressed, but it's good because it makes me focus on where I have to go. And I think that our achievements are spurred sometimes by the stress that we experience as long as we manage it. Okay. We have to have problem solving skills, and sometimes our creative thinking is stimulated by stress. It's the unmanaged piece of it that we've been talking about, which is really problematic. So it's trying to find your way to mitigate and push back against the automated response. That will be one of the best things you can do to keep
And the
yourself.
critical part is being proactive.
Yes.
Because in the moment that you're stressed, you're not thinking of strategies to use.
Right.
And that's why it's important to practice
We
it.
got a plan.
Let's talk about the downside.
All right. Well, unmanaged stress, as we talked about, affects millions of people. Okay. Millions. Chronic illness of several kinds, which is talked about a lot in the media these days, is what kills us. Okay. And it can sneak up on you when you're paying very little attention to your body's response to stress. And all of a sudden, something happens, and you end up at the doctor's office and you find out you've got XYZ problem and you've got to start taking medication. And it never occurred to you that that was going to happen. You're so shocked. But we knew a retired lawyer who never, ever thought about stress. He was under stress a lot. He was in estate planning and some other things where he had a lot of deadlines. He finally retired, and it dawned on him that if he wanted to have a healthy retirement, he was going to have to start taking care of his body. So he went the opposite way. He became obsessed with health. He wants to write a book about it. But I was shocked when he said to me, I never thought about my body at all for the 30 years I practiced law. I mean, as a nurse, I couldn't process that, but I don't think it's so uncommon. I'm just saying, pay attention now so you don't end up like that and having to go to the extreme opposite of where you are so that you can have a healthy end to the retirement career and so forth and have a healthy life.
So these are obviously some of the specifics that we've talked about that affect our health if we don't manage our stress, like the cardiovascular impact
Right.
or the mental health impact. You want
Right.
to talk about that for a second?
Oh, of course. I think that probably we don't see how people get to their chronic illnesses. I hear people brag that they only get 4 hours of sleep a night, and I'm thinking this is insane. There's a book on your reading list, Why We Sleep, which I highly recommend. It will tell you how dangerous it is not to sleep. Some people in the aging field say that getting adequate sleep is like taking out the trash at night, clearing your brain of stuff that's not supposed to be there. And when you sleep, it's gone. And if you don't sleep enough, it stays there, and that leads to cognitive impairment, Alzheimer's disease, etc. So there's a lot of emerging evidence that poor sleep habits are a significant risk factor for these chronic illnesses. And I think it's important to honor the need to sleep your 7 or 8 hours as best you can.
We've already touched on the mental health aspect.
Right.
Obviously, we've also talked a little bit about how ongoing unmanaged stress affects our immune system.
Exactly. Have you ever noticed that when you're under stress, you get more colds? You're likely to get the flu. COVID made this very apparent, but there are other sneaky chronic illnesses that are not in the big ones that necessarily kill you. Gastric digestive problems, constipation, constant irritability, depression. There are a lot of things that tell us we need to sleep. We need to rest. We need to take care of our immune system on purpose. It
I-
doesn't run on autopilot.
I also found it interesting that people that are under a lot of stress, when they finally take a break, they often get sick.
Yeah, that's true. Their body finally says, oh, goodness, now I can relax. Let me just try to heal from all the things that have been badgering my mental health and physical health.
All right.
So a lot of people think going out for a drink is going to relax you. Here's the bad news about that. It may make you feel relaxed for now. It does not dispose of stress hormones. Alcohol is a central nervous system depressant. Fine. Maybe you don't feel as uptight.
It's not going to dissipate.
It's not going to fix your stress response. Food does not fix your stress response. Ignoring unrelenting pressure, the thinking it'll just go away if you ignore it, does not work. Becoming work obsessed and staying at the office or wherever behind your computer for 12 hours does not mitigate stress. It's not going to fix the problem that you think you have, which is if you just get that deadline met, you'll be fine. You will not. It will hurt you more than it helps you. And if you don't delegate, that is a dangerous thing. I was working with co-counsel once, a lawyer, very, very stressed. And I noticed she never delegated anything to anybody. I mean, if she was in the position to mail something, she would lick the stamp herself. I'm exaggerating, but she wouldn't let anybody else help her because she thought she could the only one who could do it. And she started to feel ill. She just kept right on doing what she'd been doing until she had a major health crisis. Had to end the practice of law for her. So that's the risk I've seen with my own eyes with somebody I was working with on the same cases. Awful.
And what about some alternative ways to deal with stress?
Well, there are lots of things you can do besides the tools we've already talked about. Please pick some things. Journaling, write it down. Well, as lawyers write, writing by hand has a different effect on the brain than typing on a computer or your phone.
Yeah, but why journaling?
Something about reiterating what's happened in your day, what bothered you. It's almost like talking it over with somebody, except you're talking it over with yourself. And then you go back and read what you wrote and you say, geez, what a mess I was. It helps you self-evaluate your response. That's a benefit. Music obviously helps us change our mood. It's a universal language. I encourage everybody to find calming music that you like. That would probably not be acid rock, but if that helps you, do whatever helps you. Something like that, something that's musical, will help change your mood and your brainwaves.
Let's go through a couple of more alternatives until we get through to our summary slides.
All right.
All right. So some other things that we can do are.
Sure. I mean, I have had a dog for a long time. My dog came with me to work. She would sit under my desk. She would jump in opposing counsel's lap once in a while and change the mood. But just the research on blood pressure, stroking a pet lowers blood pressure. It's amazing. Being outside is important, and that's been mentioned before. There's this concept the Japanese have called forest bathing. Do you think Marin has any forests you might walk through? Excellent for your mental health. Laughter. Pick something that you think is funny and watch it on purpose because it's an antidote to the stress response. And again, if you don't have any other place to go and you can find some stairs, walk up and down those stairs a few times just to dissipate some of that cortisol and adrenaline.
And how am I going to be accountable
Okay,
for measuring my stress?
Right, this is not just talk. We want you to measure yourself. If nothing else, look at your heart rate. Okay, you can use any kind of wearable. You can use an Oura ring, you can use a smartwatch, you can get any kind of meter that lets you see what your heart rate is when you're stressed. And if you've done anything to help yourself, you can see if that heart rate goes down. Very important way to be accountable to yourself for not just your heart rate, but sleep as well, exercise too, whatever you choose.
How about some other obvious self-nurturing activities?
Listen, when they say take care of yourself, they don't tell you exactly what to do. It's too blanket and too general. Find something you like that helps you feel better. If you want to go have dinner with some friends and that helps you feel good, you're not going to talk shop, great. You want to go to a spa, terrific. You want to have a hobby, do that. I do ceramics, Nicole does stained glass, very helpful for both of us. And above all, I married Mr. Vacation, okay?
Thank you.
He insisted that we take vacations, and I, despite the fact that this might get set for trial, I have a deposition, he made me go, and I never had to miss but one vacation.
And I never understood what a spa day was.
I know.
Thank you, dear.
He had to know that it's not about efficiency. Okay. All right. So if you're thinking, Carolyn and Nicole, yeah, this all sounds great, but I don't feel like it. Okay. All right. I don't feel like it. I'm busy.
Do it later.
I got a busy practice. I don't have enough billables this month, whatever. Okay. All the success in the world is not going to help you if your health breaks down, and your health can break down. So start with one thing we have discussed today, and we're going to finish off with that thought when we're done here, and we're almost done. All right. Remember, your client's stress is also creating a risk for you. Okay. Anxious and upset clients affect us. They want us to fix it. They want it to be done yesterday. They pour out their own stress and reactions to whatever you're trying to do for them, and they lay it on you. And this is a risk we need to be conscious of, because if you've been okay yourself knowing you're doing a good job, the best you can, and there is a deadline and we don't know what the judge is going to say, or we don't know what's going to happen if you present that proposal, whatever it is, it's the inherent stress that the client is laying on you that you've got to work on yourself so you don't suck it in and take it in. It's part of your normal working day, maybe, but it applies to everyone, whether you're a litigator, a mediator, a consultant, as I am, or you do something else. Remember, that stress is also coming at you and will trigger some kind of stress response in yourself.
And there's no training as an attorney.
No.
You know, as a psychologist, we get training because we're dealing with suffering all the time,
Right.
and struggle that people are going through.
Right.
We get training about how it is that you learn the skills to not internalize the pain.
And that's completely missing from legal education.
All
Okay?
right, so let's deal with our summary right now
All right.
and our takeaways.
All right. So remember, you're not going to get out of being stressed. Stress is normal. You're not going to get out of your automated response that's biologically hardwired into all of us, but you can push back on it. You can do any of the things or all of the things we talked about today to help you manage your stress better, whether it's short, medium, or long term. Be sure you remember breath work, at least one of the breath work exercises, because those are available to you instantly with no training. And you can use any of the other tools, and I encourage you to look at those as protective of your life, because they are protective of your life. You want to be conscious of how to address all these different kinds of stress with different tools. All of these things are different, okay? And they take habits. You got to build some habits that you maybe have never done before. Maybe you're used to exercising, but you didn't think about breath work. Maybe you've done some things to calm yourself down when you're pushing back against stress, but you never thought about dissipating cortisol that's in the background, still in your body. We want you to think about that. And we want you to take that away from this presentation.
But wait, you have homework.
All right. I want all of you, please take out your cell phone, put something on your calendar for tonight or tomorrow that you're going to do one thing. Maybe it's 4-part breathing. Okay. Maybe it's listening to an app for
Spa day.
meditation. Spa day, right? Take a vacation is what he would say. Put it on the calendar now. You're going to be gone for a week. All right. But the commitment is long term. Put that down. Be accountable to yourself. Keep your commitment to yourself. Honor your own integrity. You're going to do better. You're going to feel better. And you're probably going to succeed more when your stress is managed better. And we do have time for some questions.
A little bit of contact information, and then we can move on because we've got a couple minutes left for some questions.
Chris.
All right.
So we have one question so far. Have you worked with attorneys who've been given a troubling diagnosis, such as Parkinson's, and how to address the stress related with such news?
Do you want to go?
I can talk about that from the perspective that we have. We are consultants in the aging field. Most of the people we work with are the adult children of elders with issues, health issues, dementia a lot, long-term illness like Parkinson's a lot. But some of the people are our own brethren in the law. Answer, yes. Because the prospect of long-term illness, especially kind that you can't fix, like Parkinson's, which is a progressive degenerative disease that does not yet have a cure. There's treatment. There are things people can do to mitigate the effect of Parkinson's disease and Parkinsonism, which is a little different. But I think the risk is that if you don't look at what it is doing to your self-esteem, your self-image, and your willingness to face that we are all going to pass someday, that there is an end to the life cycle, and that just brings you more face to face with it, that you're going to have a harder time. Depression is a common reaction to a diagnosis that is life-threatening or scary, even if it
As
isn't
people
life-threatening.
self-isolate,
Right.
they are feeling embarrassed.
They withdraw.
They are concerned about the physical shaking and being in public and the sense of embarrassment of other people seeing them in a less vital kind of condition. Um, they need the support and that community aspect that we talked about, which is a very important part of managing stress. Having community, having other families that you can seek out that are equally going through that. The advantages now with the internet, with being able to even find Zoom communities that are dealing with it and getting the support.
Support groups.
All that is really important. And different kinds of medications now. We've been seeing more and more use of things like alternative plant medicines, like the use of CBD, in being able to help people with different kinds of Parkinson's or different forms of dementia, which it adds to lowering their level of attention and anxiety.
Anxiety, right. I think what's also important is to share. You know, there's a person that I know who is not a lawyer, but is in a group with me and was diagnosed with breast cancer and had to go through a chemo, and she lost all her hair, and she bravely showed up bald. No scarf, no wig, just showed up bald and shared with everyone. And I will tell you, in my estimation, from a nurse's point of view, she is coping better with the diagnosis of breast cancer than anybody would who wanted to keep it a secret. It's about being open and vulnerable.
Other questions, Chris?
Yes. Any suggestion on how to lower our clients' stress during meetings so they can make rational decisions?
I love that one. That's a great one.
Right. We mediate family pissing contests that you wouldn't believe the level of nastiness, and it's not necessarily about money. What I can say is we listen without interrupting. Lawyers are not very good at this. They don't teach you listening skills in law school. Nurses were taught that. We had to have communication skills for 6 months before we could touch a patient. And I'm not always the best listener in spite of all that wonderful education, but it is something I know about. And I understand that listening releases the person's tension. And I heard you say, and then recreate what they said.
Well, I think the other thing that's really helpful is that as the attorney, you can often predict the kinds of things that are going to trigger your client
Right.
in advance.
Mm-hmm.
And I think having an open discussion that it's more likely than not, these are the kinds of things that are going to trigger you. How in fact would you like to respond other than calling the person an asshole? That might be an appropriate response, but I mean, how are you going to respond? Again, being in the world of choice and offering them different ways that they can best do it. And more importantly, as their attorney, how can we support you in making a better choice so that we can be productive in what it is that we need to do?
Right. And I think sometimes you have to remove the client from the situation unless they're just yelling at you in your office and say, listen, I know this is upsetting. Tell me what's going on.
Or planning ahead and making sure that you can separate parties. We do that all the time in terms of settlements that we do in court. So,
Right.
I mean, just thinking ahead of it.
You don't want to ignore the emotion. That's the main thing. Do not ignore the emotion. Give it some space.
All right, we've got a little bit more time, Chris.
Anything else?
There was just a real quick statement following the Parkinson's question about trying prayer.
I think that it gives people a sense of community. If there are prayer chains and letters and very things that people of faith do to support one another, there are support groups. All of those are helpful because, again, it builds a sense of community and removes the severe stress that comes from feeling so alone.
Right.
It's so dangerous to feel alone. It leads to bad health outcomes. It can make disease worse. The longest lived people in the world that have been studied have community. However you get community, whether it's online, whether it's talking to friends, whether it's going to a group in person, do it. It is extremely effective in helping reduce the tension that comes from that scary diagnosis or occurrence that's going on in your life.
We also just wanted to remind you, take a look at the handouts. They have the 6 tools that we talked about in managing stress. We have the script for the progressive relaxation and a very brief reading list that we think you might enjoy.
And I want you all to do your homework
Oh,
and
yes.
get that one on your calendar that
Oh, my.
you're gonna try.
That's right. And we're going to check on you.
Right.
Thank you very much for allowing us to speak to you today.
Thank you very much. I've read the Body Keep Score. It's a very interesting book. And I just got an Aura ring yesterday.
All right.
So-
You'll know how much you exercise and how much you sleep and where your heart rate is.
Exactly.
Great.
So thank you everyone for attending this workshop and the entire conference. You should have received an email this afternoon with all the evaluations in case you missed filling one out. Please complete them because it really helps us plan what we can do next year. Today's is in the chat. And then the other thing I want to tell you all is we're going to be at the Burn House at 4:30 today. We are providing appetizers, so I hope you'll join us. They have non-alcoholic drinks as well. And if anybody has ideas for other social activities that the bar can do that are not at a bar or restaurant, such as Thirsty Thursdays, please email me personally because my goal this year as president was to get more community, and we've done a lot of giving back to the community through our coastal cleanup, and earlier this year cleaning up the park or planting trees in the parks, as Nestor said. So I would really appreciate any ideas you have that I can bring back to the board. So thank you again, McCall and Carolyn. Hopefully we'll see you at Burn House, and everyone have a good evening.
Good night.
Good night.